The Gold EF registry was a multi-center, multinational registry, a prospective registry to evaluate the safety and the efficacy of the second generation PVAC catheter, which was changed from the earlier generation because although the earlier generation was shown to be effective and safe, and especially had shorter procedure times than other existing technologies at the time, there were some issues with asymptomatic cerebral embolism, which caused concern in the EP community, and for that reason the catheter was changed to gold electrodes, 9 gold electrodes instead of the 10 platinum electrodes. And the aim of this trial was to re-evaluate whether this new catheter, the redesign of the catheter, was safe and effective for the patients where we normally in everyday life treat our patients with atrial fibrillation. The design is a multi-center, multinational registry, a prospective registry, and the aim was to include more than 1,000 patients, regular clinical patients that were scheduled for a ablation of atrial fibrillation with the phased RF system. Well, we looked at several things. We looked at procedural outcome data from the procedure up to 30 days outcome, and this was primarily aimed at safety. And what we found was that the adverse event rate was low, less than 3%, 2.3%, and most of these adverse events had nothing to do with the technology, but just had to do with the fact that we performed an ablation. So most of the complications were groin complications with the vasculature. There were only a few complications related to other side effects. We had a very low rate of stroke and TIA. 3 of the more than 1,000 patients suffered TIA or stroke, so that's 0.3%, which is very low and within the range that we know can happen with atrial fibrillation ablations. And there were no esophageal fistula and no deaths surrounding the patients in this patient registry. The other endpoint was long-term efficacy. All these patients were followed up according to standard of care in all the centers, which was not predetermined, so there was no predetermined repetitive Holter or ECG monitoring, but this was left up to the discretion of the investigators who do this for all their patients. And so this was the same as what we do I think in real life practice. And what we found was that the efficacy, the freedom of atrial fibrillation as reported by the investigators was 77%, which I think is a very nice and impressive result considering the fact that 70% of the patients were PAF, paroxysmal patients, where we know the results are a little bit better, but still 30% of these patients had persistent or long-standing persistent AF, but still, even while 30% of the patients had more difficult to treat atrial fibrillation forms, still the overall clinical outcome was 77% freedom of AF, which I think is an impressive result for such a registry. And now the last and third outcome that we presented on was the symptoms and the quality of life. And what we showed was 3 different assessments. We used the affect quality of life assessment, we used the EHRA symptom score, and we used the symptom severity score. And actually for all these 3 symptom scores and quality of life scores, we saw an impressive and marked improvement in quality of life and a great reduction in symptoms of atrial fibrillation. And this was a significant reduction in most patients. We even found that even in patients where we had a recurrence of AF or sometimes had to do a redo procedure for recurrence of AF, even in these patients a remarkable improvement in their quality of life and a reduction in their symptoms was seen, because even though they had recurrences of AF sometimes, their burden of AF was lower and they felt more comfortable than before the procedure. And although this may in part be a placebo effect, because sometimes people feel better because they are treated and even though they still have AF, it probably also reflects the fact that their AF burden was lower and that they may have had less episodes or less severe episodes or less symptomatic episodes of atrial fibrillation. So even after one procedure, this technology and the fact that these people were ablated with this technology already conferred a big improvement of the clinical situation of these patients. I think that what this registry now has shown that this is a very feasible procedure which transmits a big improvement in the clinical situation of the patients, and it's reliable, it is quick, it has been shown already in other studies that it's quicker than other technologies, it's safe, and it's reliable, and what we have shown is that the patients feel a lot better after this ablation. That is not unique to this ablation, but the fact that you combine it with good outcome and with good timing and short procedures make this an attractive workhorse to perform quick ablations. And maybe in some patients you will need to do other things as well, and we will see in the future whether new technologies or new energy sources may come around that may even improve this type of ablation. But I think that for everyday practice this is a very reliable and a very easy workhorse to perform atrial fibrillation ablations with. Well, obviously with this we will publish the data of the registry and we hope that this will renew the enthusiasm of people that are using the technology, and maybe it will even help to make people that maybe used the technology before but may have been a little bit discouraged by some of the findings of the technology, that with this registry we renew the enthusiasm of both the existing users and maybe old-time users that may want to reconsider to start using this technology again because it's so reliable and quick, and you don't need to have concerns about the safety of the technology.